And we welcome you back to our program. As always, our program on Thursday is brought to us by Kaiser Permanente, and joining us today, one of their fine doctors, Dr. Nguyen joins us today. Dr. Nguyen, welcome to the program.
Thank you for having me, Rob.
Good to have you on the show today. Family medicine, your specialty down there. You've been with Kaiser, what, about 8 years, I think?
Correct.
What about yourself and where you went to school and how you got involved in medicine?
It's interesting. I've always really been interested in medicine and probably was pushed a little bit too much by my parents. Luckily, I actually liked the field, but I grew up in Sacramento, was there for about 25 years, went to UC Davis as an undergraduate, was fortunate enough to stay there for medical school, and then as fortune would have it, I met a lovely young gal from Southern California who then led me down here, and I went to Kaiser Fontana for my family medicine residency, and I've landed in Orange County for the last 5 years.
Obviously, the mix with Kaiser was a good one, and you stayed with them.
I've always been happy with Kaiser Permanente and really allowing me to practice the type of medicine that I'd like. And they do a lot of stuff to really help me out in their system. Yeah.
That's great. Well, our topic today is an interesting one. I think obviously appropriate to our residents here in Laguna Woods Village. The topic is longevity. From a medical standpoint, obviously, you know, we just look at it as an X number of years. Someone lives to be 103 or 97 or whatever. But from a medical standpoint, how do you define longevity?
And that's a very interesting question because longevity means a lot of things to different people. But in the medical field, to me, it really means, you know, two things. It not only means how long someone is alive for, but really their quality of life. And I think really that's the most important thing that people are going after. You know, where am I going to be and what am I going to be doing in my later years in life? And I think that can be achieved through a couple of things. You know, if you balance out exercise, good diet, and really taking care of your soul and your spirit. I think those three are really important to achieve longevity. You know, a lot of people, you know, we tell them to exercise, and what I usually recommend is about 30 minutes a day, 3 days a week. That can be achieved through walking, running, but a lot of people don't realize that also doing stuff that is weight resistance based is also very important. It helps out with conditions like osteoporosis, things that really affect people later on in life. Foods is kind of obvious. You know, I often get asked in my clinical practice, what is the best diet to be on? And my response is, it's a diet you stay on. So whatever you can actually tolerate and eating in moderation, that's really the key. We are a culture of supersizing. We supersize everything, and it's everywhere. So we can actually downsize, pick a balance of foods that would generally work for most people. Lastly, it's emotional and spiritual support. If we don't feel good emotionally, despite what how good our bodies are, we're just going to feel horrible. And that does not lend to good longevity.
Right. So that could be spiritual in the religious sense, could be spiritual in the nature sense, could be a walk on the beach, could be a spiritually uplifting event for some people as well.
And for a lot of people, it's, you know, I often tell them it's also about family. Who is your family? And making sure that they have contacts with you, make sure that you're still a part of their life. And that's really important from the spiritual standpoint. It helps people going, and it helps motivate them to do the things that keep them alive longer.
I know Barbara Streisand had a big hit song a few years ago with People Who Need People.
Yeah.
And, you know, people that isolate themselves tend to have maybe more problems, both physical and psychological. So certainly reaching out, becoming a part. And of course, this community is a great place for that with over 200 clubs and 7 clubhouses and lots of ways to be involved here in our community. What about when someone comes in to talk to their doctor? Obviously, they can ask some of those questions, you know, and you do the test. You go, well, your cholesterol is okay or not, your blood pressure is okay or not. These other tests we've run on a periodic basis look either good or bad, and that's it, medical advice. Are those some of the kinds of things, and then maybe even more into the relaxation, maybe meditation, involvement, other areas that we've talked about as well, things you can help the patients with?
It's a great point. And what I think what you're summating is what we really advocate at Kaiser Permanente, and that's preventative care. You know, prevention. That will help people live longer, live better. That's why I believe it's very important at every visit that at least 1 or 2 things, minimum, be done to address a preventative care need. That could be a look at the patient's blood pressure. It could be to look to see if a patient's had a recent mammogram to check for breast cancer. It's also to look to see if a patient has gotten their flu shot. Obviously, with the upcoming flu season and swine flu, it's very important to people that they get it. And we at Kaiser Permanente really try to push this because it helps to prevent illness.
I understand this year there's maybe going to be a 2-phase because of the swine flu for more younger folks and healthcare workers, and then maybe those of us a little bit older will get the regular flu flu shot, and then maybe down the line add in the swine flu as supplies become available. But I guess unlike the past, it's always been healthcare workers first, and then older folks next for the flu shots. This year it's a little bit different for the swine flu.
It is a little bit different because of the types of age populations that the swine flu has affected this year. Obviously the details are still being worked out, and we're definitely going to try to outreach as many people as possible once we get the information and the supplies.
Yeah.
The great thing about our organization is because we are integrated and everyone's in one computer system, we have great outreach efforts like telephone calls, computer systems, emails, that we can get a hold of people to get them to come in if they need these shots.
All right. If you could sum it all up, a most important or a single factor to help someone's longevity?
You know, a lot of things are very important for longevity, but a lot of it is actually common sense. And the thing about common sense is it is not done commonly. So the most important thing about longevity is to do something and to do something consistently. So all the things that we talked about, if you just do it on a regular basis, make it a habit and a part of the life, in a normal routine, I think that's the best way to to promote good longevity.
All right. Dr. Nguyen, thank you so much for joining us tonight. Appreciate the good information. Some good tips on longevity. Just one of the fine doctors practicing over there with Kaiser Permanente at lots of fine facilities around Orange County. Give them a call, find out more, and find out how they can maybe help you out with your health care and, of course, your longevity as well. We'll be back with more right after this.